what's up guys? So I'm going to do a demonstration on a rapid trauma assessment. So with this rapid trauma assessment, it's on a sterile patient. There's no wounds on them. It's just the neuromuscular connection that I use and the thought process that I use. It's by no way the standard, it's just a technique that I use. So that being said, we'll be using the MARCH algorithm, so massive bleeding, airway, respiration, circulation, and head trauma hypothermia. So once again, this is just the techniques that I use. It is a way, not the way. So the first thing we're going to do is say PSI, I've got it. Fire superiority has been achieved. We're not on POI anymore, so he's off the X. So I have the ability to do my RTA, because on the X we never do an RTA, we just do tourniquets. So that being said, get out to my patient. I'm going to check for massive bleeding, and I do the raking technique. I find that saves time, and if there's any tears of the tissue or any injuries, I can usually catch it with my fingers. So blood sweep. The blood, raking the chest, no blood, no suck, no blow. Check the arm, no blood, no blood, no blood, no blood. And for the back, I do, it's called the bro hug. So lift him up, rake. Obviously he's a mannequin, it's a little harder to do. Rake, put his arm back. So now with that, we're gonna move on to our airway. So airway, inspect, teeth and tongue attack, no blood, no mucus. I feel one breath every 3 seconds. So breathing, inspect, auscultate, palpate, percuss. Expose the chest, inspect, I don't see any injuries, no suck, no blow. I have bilateral rise and fall of the chest. I'm gonna listen to lung fields. Upper, or apex, base. I'm gonna check for the PMI, cardiac PMI. Once it's found, I'm gonna mark it. If there's a shift in PMI, could be indicative of tension pneumothorax or for a cardiac tamponade. Now that's done, I'm going to go through my RTA. So I did airway, breathing, circulation, radial pulse is intact and equal, pedal pulse is intact and equal. So now for the rapid trauma assessment. I'm checking the head for decap BTLS, checking the eyes for Parella, checking the nose for rhinorrhea, checking the ears for otorrhea, periorbital ecchymosis, postauricular ecchymosis, teeth and tongue still intact, no blood, no mucus, airway secure, no tracheal deviation, no JVD, no step off. For the chest, clavicles, shoulder girdle, sternum, ribs, still no suck, no blow. For abdomen, turd P, rolling my fingers, doing that palpation. Pelvis, close the book, open the book. Pubic symphysis, check for priapism. Leg, decap BTLS, BTLS. Pedal pulses. Hey brother, can you wiggle, can you feel? If you can't, use Babinski's. All right, so if you get a Babinski's that's reversed, it's indicative of a neurological deficit. All right, decap BTLS. Radial pulse is still intact. Hey brother, can you squeeze my hands? Awesome. Then log roll on my helpers count, 1, 2, 3, log roll. Do that raking motion. All right, checking for step off of the spine. All right, go down the spine, credit card sweep. Also, no suck, no blow, looking for injuries to the back, roll back, 1, 2, 3. Since I just moved him, I have to reassess the airway because every time you move them, reassess airway interventions. Teeth and tongue intact, no blood, no mucus. Still have 1 every 3. All right, so that's the way I do my rapid trauma assessment. If you guys have any techniques that you'd like to share, feel free to do so. Thanks, guys.